welcome back to my channel. Today we're going to talk about gout, a painful and often misunderstood form of arthritis that affects millions of people worldwide. Gout is caused by an accumulation of uric acid crystals in the joints, leading to episodes of intense pain, swelling, and inflammation. While it can affect anyone, certain risk factors make some individuals more susceptible than others. Fortunately, with proper diagnosis and management, gout can be controlled and future flare-ups can be prevented. Understanding the symptoms, causes, and treatment options for gout is crucial for anyone affected by this condition. Gout is often associated with lifestyle and dietary factors, but genetics and other medical conditions can also play a role. By recognizing the warning signs and seeking appropriate medical care, individuals with gout can prevent complications and maintain their quality of life. Hi, I'm Dr. Knapp, family medicine physician, here to bring you medical information so you can take control of your health and make the most of your doctor visits. Let's get started. Gout is characterized by sudden and severe attacks of joint pain, most commonly affecting the big toe. These attacks often occur at night or early in the morning and can be excruciating, sometimes waking people from sleep. The affected joint becomes swollen, red, warm, and extremely tender, making it difficult to walk or even tolerate the slightest touch. While the big toe is the most frequently affected joint, gout can also occur in other joints, including the ankles, knees, elbows, wrists, and fingers. The pain is typically at its worst during the first 12 to 24 hours of an attack, but inflammation can persist for several days or even weeks in more severe cases. Some people experience only occasional gout attacks, while others have frequent recurrences, which can lead to long-term joint damage if left untreated. In addition to joint pain, some individuals with gout develop atophus, which are lumps of uric acid crystals that accumulate under the skin. Tophi commonly appear on the fingers, toes, elbows, and ears. While they are usually painless, they can become inflamed and lead to joint deformities if not managed properly. Another potential complication of gout is kidney stones, which can occur when excess uric acid forms crystals in the kidneys. These stones can cause severe pain in the lower back or abdomen and may require medical intervention to remove. Gout occurs when there is an excess of uric acid in the bloodstream, a condition known as hyperuricemia. Uric acid is a natural waste product that forms when the body breaks down purines, substances found in certain foods and produced by the body itself. Normally, uric acid dissolves in the blood and is eliminated through the kidneys. However, when too much uric acid is produced or not enough is excreted, it can accumulate and form needle-like crystals in the joints, triggering inflammation and pain. Several factors increase the risk of developing gout. Diet plays a significant role, as consuming foods high in purines such as red meat, shellfish, and organ meats can raise uric acid levels. Alcohol, particularly beer and spirits, also contributes to gout by interfering with the body's ability to eliminate uric acid. Sugary beverages and foods high in fructose have been linked to an increased risk of gout as well. Obesity is another major risk factor, as excess body weight leads to higher uric acid production and reduced kidney function. Certain medical conditions, including high blood pressure, diabetes, kidney disease, and metabolic syndrome, are all associated with an increased likelihood of developing gout. Genetics can play a role, as some people inherit a tendency to produce too much uric acid or have difficulty eliminating it efficiently. Additionally, certain medications such as diuretics used to treat high blood pressure and low-dose aspirin can contribute to elevated uric acid levels. Diagnosing gout involves a combination of clinical evaluation, medical history, and laboratory tests. A healthcare provider will assess symptoms, including the pattern of joint pain and any previous episodes of swelling and inflammation. A detailed history of dietary habits, alcohol consumption, and family history of gout will also be considered. The most definitive way to diagnose gout is by performing a joint aspiration, also known as arthrocentesis. This procedure involves using a needle to extract fluid from the affected joint, which is then examined under the microscope for the presence of uric acid crystals. If needle-shaped crystals are found, gout is confirmed. Blood tests can be helpful in measuring uric acid levels, but they are not always conclusive. Some people with high uric acid levels never develop gout, while others experience gout attacks despite having normal uric acid levels at the time of testing. Imaging tests such as X-rays, ultrasound, or dual-energy CT scans may be used to detect joint damage or uric acid crystal deposits. Ultrasound is particularly useful for identifying early signs of gout in soft tissues, even before a full-blown attack occurs. Gout management focuses on treating acute attacks, preventing future flare-ups, and addressing underlying risk factors. During an acute gout attack, the primary goal is to relieve pain and inflammation as quickly as possible. Non-steroidal anti-inflammatory drugs, or NSAIDs, such as ibuprofen or naproxen, are commonly used to reduce swelling and discomfort. These medications should be taken at the first sign of an attack to minimize its severity. Colchicine is another medication often prescribed for acute gout attacks. It works by decreasing inflammation caused by uric acid crystals, but must be taken early in the attack to be most effective. However, colchicine can cause gastrointestinal side effects including nausea and diarrhea, so it should be used with caution. Corticosteroids such as prednisone may be used when NSAIDs and colchicine are not suitable. These medications help reduce inflammation and pain and can be taken orally or injected directly into the affected joint. To prevent future gout attacks, long-term management focuses on lowering uric acid levels. Lifestyle modifications, including dietary changes and weight management, play a crucial role. Reducing the intake of high-purine foods, limiting alcohol consumption, and avoiding sugary beverages can help decrease uric acid production. Drinking plenty of water promotes kidney function and helps flush excess uric acid from the body. For individuals with recurrent gout or persistently high uric acid levels, medications may be necessary to prevent future attacks. Allopurinol and febuxostat are commonly prescribed to reduce uric acid production, while probenecid helps the kidneys eliminate uric acid more efficiently. These medications are typically used long-term and require regular monitoring to ensure they are working effectively and not causing side effects. I just want to take a moment to ask that you hit that like button and subscribe to my channel. Leave a comment below if you have any questions or topics you want covered in future videos. Anyway, lifestyle changes, including regular physical activity and maintaining a healthy weight, can significantly reduce the frequency and severity of gout attacks. Exercise helps improve overall metabolism and reduces inflammation, but it is essential to avoid excessive strain on the affected joints during flare-ups. For individuals who develop tophi or suffer from chronic gout, more aggressive treatment may be needed. In some cases, surgical removal of tophi may be considered if they cause significant pain, joint damage, or functional impairment. Managing gout also involves addressing any underlying health conditions that contribute to elevated uric acid levels. Controlling high blood pressure, diabetes, and kidney disease can improve overall health and reduce the risk of recurrent gout attacks. So gout is a painful and potentially debilitating condition, but with proper management it can be effectively controlled. Recognizing the symptoms early and seeking medical attention can help prevent complications and long-term joint damage. Diagnosis is usually confirmed through clinical evaluation and joint fluid analysis, and treatment focuses on relieving acute attacks while preventing future episodes. Lifestyle changes, including dietary modifications, weight management, and regular hydration, are essential in reducing the risk of gout. For those with recurrent gout, medications that lower uric acid levels can help maintain long-term control. If you or someone you know experiences sudden intense joint pain, swelling, or redness, it's important to consult a healthcare provider for an accurate diagnosis and appropriate treatment. By taking proactive steps, individuals with gout can lead a healthy, pain-free life. Thank you for watching. As always, take care of yourself and make the most of your day.